Hello everyone, I am Dr.Rachita Munjal, Senior Consultant, Birla Fertility and IVF Gurgaon. Today we'll talk about two terms which are very commonly used in assisted reproductive techniques, IVF and ICSI. Difference between IVF and ICSI treatment. IVF and ICSI both are assisted reproductive techniques in which egg and sperm are fertilized outside the body in the lab, not in the body. So the difference is just the process which is followed in the lab, but for you the treatment remains same, the process. So IVF or ICSI treatment process starts from ovarian stimulation, in which women is given Gonadotropin Injections. Serial ultrasound monitoring is done to see the follicle size. Once the follicle size reach adequate size, egg retrieval procedure is done. On the day of egg retrieval procedure, semen is taken from the male partner, or sometimes the surgical technique is used to retrieve sperm. Semen wash is given and the motile sperms are segregated. Now comes the process of combining egg and sperm. So in IVF, eggs are put in a Petri dish and sperms are put in the Petri dish. So egg and sperm fertilize on their own in IVF in Petri dish in the lab. But whereas in ICSI, which is Intracytoplasmic Sperm Injection, the embryologist inject sperm into each egg manually. So the fertilization is done manually by the embryologist. And now the resulting embryo is formed, which is grown in lab for about 3 to 5 days. And then this embryo is transferred back into the woman's uterus to attain pregnancy. Both IVF and ICSI result in embryo formation. But in general, ICSI has higher fertilization rates. But IVF has to be done or ICSI has to be done. It will be decided by your embryologist and by doctor, depending on various conditions. Like ICSI is generally done in cases where there is male factor infertility, the sperm count is low, or sperm motility is low, or there is poor sperm morphology, wherein during ICSI, embryologist can select best of the sperm to fertilize it with egg. ICSI is also recommended in women with advanced age where the outer layer of egg, which is called zona, becomes thick, and sometimes IVF does not result in fertilization. ICSI also recommended for couples with previous history of fertilization failure or previous IVF failure treatments. So your doctor and embryologist will decide whether to go for IVF or ICSI. For you, the whole treatment process remains same, only the difference is the procedure in the lab. So it's very important to discuss during your IVF treatment with your doctor whether you're planning IVF treatment for me or ICSI treatment for me. Although both will result in embryo formation, ICSI has better fertilization rate and will depend on your condition which process your doctor will choose for you. But it's important to know the difference between two, and both result in embryo formation. Both has its own pros and cons, and your doctor, after discussion with you, is the right judge to decide the right treatment for you. Thank you.
Book a free consultation today.